thank you to Herman and Audi for the invitation to come and speak to you today. It's a pleasure to be with you in Bucharest. I've never been here before, so I'm very interested in seeing your office space. Is quite grand compared to what we work out of in Holland, but it's very nice to be here. I'm the executive director of North Star Alliance, and we are a non-profit organization working with ORTEC now for over 5 years. And it's been very interesting this afternoon listening to different people with their experiences with ORTEC, talking about different aspects of improving logistics and planning. And it's actually, for my story, it's kind of funny to think back to the origins of logistics, and the professionalization and the origins of logistics, of course, have to do with the military, with war. So for my presentation in the healthcare industry, I'm going to take you to the front line in a war. The front line in the war against HIV and AIDS. And you may not often see these sort of pictures, but this is actually what the front line looks like. In 2002, 2003, there was a hunger crisis in southeastern Africa. So we're talking Mozambique, Malawi, Zambia, and Zimbabwe. And many of you may have heard of the United Nations World Food Program. Well, the UN World Food Program is responsible for delivering food in another type of war, the war against hunger. And the logistics teams from the WFP are very, very good at what they do. They can get food to places that you and I wouldn't even know how to get ourselves. And in their 2003 crisis, they were getting food into Malawi at incredible rates, but they couldn't distribute the food. And they couldn't find enough local transport capacity. They couldn't find enough truckers to get the food from the ports out to the villages and the people who needed it. And they couldn't understand why this was, because they'd done an evaluation and a logistics capacity assessment beforehand. And out of that capacity assessment, which was done 2 years previously, they said there is more than enough transport capacity to meet any emergency down here. So 2 years later, the emergency's there and the capacity's gone. What happened? HIV happened. AIDS. It wiped out almost a whole generation of drivers in southern Africa and in many other places in the world. It wiped out to the point where when the WFP did its analysis, the estimated average working life expectancy of a driver was 5 years. So what was going on? Drivers in Africa and other parts of the world are vital links in supply chains, but they often don't get much attention in your supply chain. In Africa, a long-distance driver can spend an average of 27 days a month away from home. So being away from home, being in strange places with low security, being stressed, they also come in contact with vulnerable women or people who have less opportunity than they probably like, and engage in sex work. And out of these places where the trucks come together with local communities, in epidemiology terms, we have what calls hotspots. So places where mobile populations come into contact with static or stationary populations. And if you look how disease spreads, this is nothing new under the sun. If you look at the plague in Europe, 1347, a cargo freight ship pulls into Marseille from China, and Europe gets introduced to the Black Plague. If you think about SARS, if you think about the Mexican flu, if you think about avian flu, transport moves disease. And so too, transport moves HIV. When WFP was confronted with this problem, being logistics people, they took a different approach to health. They looked at it from a logistics perspective. What's the problem? These guys, and these people, the women as well, are in places, they're on the road, they're mobile. We cannot reach them with traditional approaches. We can't reach them with hospitals. We can't reach them with condoms. We can't reach them with information. So being logistics people, and being good logistics people, they decided to say, okay, if we can't get them to come to us, we will take the health care to those people. So they set up what's now become known as a roadside wellness center in 2005 in Malawi. They put a shipping container down at a truck stop, they put a nurse in the shipping container, they put an outreach worker in the shipping container, and they opened it in the evening when the drivers were stopped and waiting to cross the borders. And in this part of Africa and in many other parts, it can take an average between 72 hours, in some cases up to 3 weeks to cross a border. So these guys are spending a lot of time at these places. The clinic was a great success. It was visited. Within 2 years, 80% of the drivers on the routes had heard of this clinic. More than half the people had been once, half of the drivers, and over 10% were making it a regular stop every time they passed through. So we were reaching the people with information. And that was great for that one place in 2005 and 2006. It was very nice that we had one little spot where one little group of people were coming in contact. But of course the problem was much bigger. So the World Food Program, together with another logistics organization called TNT, decided to do something about it and to set up a network of these wellness centers across the main transport routes in Africa to try and hit the disease where it was being spread at the hotspots. So in 2006, at the end of 2006, they created an organization called North Star Alliance. And North Star Alliance has now opened up over the last 6 years a network of 30 roadside wellness centers in 14 different countries in Africa. And we've done this in a different approach by not only taking healthcare to the people, but we've also done it by mixing corporates together with public health, together with humanitarians. We work with over 70 different partners, ranging from big companies like Chevron and Heineken and TNT, down to the governments of all the 14 countries we work in, to humanitarian agencies like the World Food Program, UNAIDS, FHI, and many other groups. But we also have a very small cluster of key partners. And ORTEC is one of those key partners. We call them our core partners, who have invested in us in a way, quietly in some cases, behind the scenes, which have made a huge difference. Because one of the problems when you want to treat mobile populations is they don't stay still. And disease goes and moves with these people. So how do you keep track of somebody who is moving all the time from place to place along the way? That's where we started to sit down with ORTEC and started to do some planning. So we came up together with ORTEC with a system which we call COMETS, which stands for the Corridor Medical Electronic Transfer System. And for the Dutch people, it's an EPD, an elektronisch patiëntendossier. For the rest of you, we'll say it's an electronic health passport. So essentially what we do is when a driver or a sex worker or a community member comes into our clinic, we register them in our system. The system synchronizes with our central database in Johannesburg. And then within 24 hours, that data, the patient's file, is available at all our clinics across the region. So that means if you start treatment at one of our clinics as a driver, and the next day you want to check on your medication at the next clinic down the road, or 2 days later, or a week later, you can walk into any one of our clinics, you can give them your number, and your patient file is available for you right in front of you. At the same time, the same system, of course, is collecting data the whole time. So you can imagine now we have 30 clinics. We're treating 220,000 key populations every year. And so the data keeps coming in. And so now, with the data on the back end, we're starting to see how the disease is moving. We can see where outbreaks are occurring. And we've gone beyond HIV. We're looking at malaria. We work with tuberculosis. We're also working into the non-communicable diseases, such as heart disease in some areas. So the war started by people who are on the move, and the solution is by moving with the people and getting close to your customers. And the great thing we've had with ORTEC over the last 5 years is it's been a real partnership in learning. When we started, we didn't know what we were doing, to be quite frank. We had a container, we were working, we're a bunch of logistics people. I come from TNT. We weren't doctors, we weren't epidemiologists. We were people who saw a problem and we wanted a solution. And we knew that solution was not the obvious one. We knew that for years and years people had been trying things and we weren't getting traction. And I think it was Einstein who said the definition of insanity is to do the same thing over and over and over again and to expect a different result. So we didn't. We decided to do a new result. And when we first started, we got a lot of resistance from the traditional medical community. They said, well, you know, what do you guys know? Your logistics, containers, that's never going to work. But now, we are now, and this is an example of what we have developed with ORTEC, able to go and tell the established medical community. We work with the CDC, the Center for Disease Control Atlanta, UNAIDS, the World Health Organization. We can tell these people what's going on the roots, on the ground, by analyzing the facts and the figures. And that was something that we learned together with ORTEC. And it's finally being recognized as well by other people. Last year, we won an award from the World Economic Forum for Social Entrepreneurs of the Year for Africa for 2012. We just won another award, or ORTEC won the award, I should say, but it was kind of a joint venture, with Computable magazine in the United States. And rumor has it that there's another award coming up in New York in a couple of weeks' time, which we stand a very good chance, although I'm not allowed to say anything, for the Global Business Coalition on Health, which Thank you.
I'm just the only one that is giving a big hand for this.
So, thank you. To wrap up, what I want to say is that obviously to express my thanks for the partnership with ORTEC over these last 5-6 years. It's been a real experience learning together. The results are amazing. We've now, just 2 days ago, I finished signing a deal with a group of an organization in West Africa which is going to spread this COMET system to 21 clinics in West Africa as well. So we're on our way to becoming the most heavily utilized patient management system in Africa at the moment. I want to say thanks, and I also want to just express to yourselves how much the world has changed around us. I sat on the plane coming here behind a group of doctors who were on their way to a conference on internal medicine. And they were the European Association of Internal Medicine was the name. And I was watching these guys, and those of you who've dealt with doctors enough, and I come from a family of medical people, so I've had my fair share of them. I was watching the doctors, and in their old ways, and some of them, they somehow sometimes have a slightly arrogant attitude, some of them. And I was looking at these people thinking, the world has changed. The future of healthcare is not going to be run by doctors sitting in hospitals waiting for people to come to them and telling them when they've been misbehaving. The future of healthcare is out in the field. It's in the front line. It's being driven by facts. It's being driven by logistics. The same thing I think applies to a lot of your industries. The facts and the figures are changing the game. And I think for us in our business, healthcare, we're very, very fortunate in that respect to have a partner like ORTEC who's helped us not only to understand the game, but to start being a leader in that game. Thank you very much.